The David Pakman Show at davidpakman.com.
Welcome back to the show. We're mostly funded by individual memberships. Please go to davidpakman.com/membership and sign up today. A new study says that even wealthy Americans are in worse health than Western Europeans and die earlier and suffer more from disease than residents of other wealthy nations. The disadvantage spans all ages from birth to 75. This was a report conducted jointly by the National Research Council and the Institute of Medicine. A lot of the details are surprising because we assume that those who are wealthier in the U.S. have better health comparable to what we see in a lot of Western Europe. Incorrect. Americans are dying and suffering at rates that we know are unnecessary because people in other high-income countries are living longer lives and enjoying better health. What concerns our panel is why, for decades, we have been slipping behind. Even wealthier Americans and those with health insurance were not as healthy as counterparts in other prosperous nations. A lot of countries were studied for this. The U.S. was in last place or close to last in 9 benchmarks, Lewis. Infant mortality, which we'll talk more about, low birth weight, injuries and homicides, teen pregnancies, sexually transmitted infections, HIV and AIDS, drug-related deaths, obesity and diabetes, heart disease, chronic lung disease, and disability. A lot of these disproportionately affect children. Is anyone surprised by this?
No.
And what I mean by that is we have a healthcare system that is designed to cure or to maintain in a chronic state of health, assuming you are medicated, as opposed to preventing. It's just, that's the system we have.
That's a major part of it. And also, our food is crap.
Right.
It doesn't matter who you are, how much money you have. If you want to eat well, you have to seek out healthy foods. And it's not easy to do, especially in certain part of the countries where you have chain supermarkets that are just full of crap.
Not to mention, look at all the flack that Michelle Obama got when she was trying to improve school lunches. Governments meddling in private lives. It's liberals telling you what to eat. She's talking about prevention. That's the reality. Talking about prevention as opposed to curing. This is not a surprise, right, Natan?
No, I mean, although I am a little surprised because I was under the impression that, you know, the wealthier you are in this country, the more likely it is that you're educated and the more likely it is that you have access to healthcare that's as good as it is in Western Europe, which probably is the case, but it's probably more of a lifestyle issue.
Right. I think so.
A lot of wealthy people are like a lot of other Americans who don't care about exercise, who don't care about what they're eating. They do what they want. They do what they enjoy, regardless of the consequences.